Welcome to today's webinar series entitled Getting Reimbursed, Updates on Billing and Documentation for Health Behavior Assessment and Intervention Services in 2020. Our presenters today are Dr. Stephen Gillespie, APA's Senior Director of Healthcare Financing, and Ms. Megan Duganhaus, APA's Coding and Payment Policy Officer. This webinar series has been pre-recorded and broken down into segments to make it easier for you to understand and refer back to. Our objectives are to understand the H&B code set review and revision process, to introduce the 2020 Health Behavior Assessment and Intervention Services, and we'll review the new CPT codes, descriptions, and coding structure, as well as provide an explanation of how the existing codes crosswalk to the new codes. We'll also apply the new codes using clinical examples and review coding guidelines, payment policies, and reimbursement values. In this section of the webinar, our presenters will discuss the Health Behavior Assessment and Intervention Services in 2020 coding guidelines and payment policies. Go ahead, Stephen and Megan.
In the 2020 CPT manual, the title of the section that covers these codes has been revised. Previously, it was titled Health and Behavior Assessment/Intervention. Moving forward, the services will now be referred to as Health Behavior Assessment and Intervention. This is also going to change the way that we refer to these services. Previously, we referred to them as H&B. Moving forward in all of the APA resources and throughout CPT resources, you will see them referred to as HBAI. Additionally, guidelines have been added to describe the difference between the assessment and the intervention services, including the definitions that we previously covered for health behavior assessment and health behavior intervention.
Additionally, one of the other changes that was made previously with our current H&B code set, there was always great confusion about for an individual patient if you could report E&M service and H&B service the same day. Even though the intent was never meant that you couldn't bill those the same day, the intent was that it needs to be by a different provider. Because of the way that was worded in the CPT manual, there was always confusion, and many payers would refuse to reimburse for H&B if a physician had used a E&M code the same day. So we cleaned up the language in the new code set. So now E&M services, including 99401 through 99412, should not be reported on the same day as the health behavior assessment intervention codes, and we've clarified this by the same provider. So related to that, HBAI services can occur and be reported on the same date of service, same date of service as E&M services, as long as the HBAI is reported by a physician or other healthcare provider, and the E&M service is reported by a different physician or qualified health provider that is eligible to perform the services located in the E&M section or the preventive medicine sections of 2020. We think that this clarification is really going to be significant because, as you can imagine, if a payer in the past had interpreted that as you can't do E&M and H&B the same day, it really made it difficult to use the health and behavior codes in primary care settings, multidisciplinary settings where you're working collaboratively with physicians and other healthcare providers.
Additionally, HBAI services cannot be billed in conjunction with the codes that are found in the psychiatry services section of the CPT manual, which includes CPT codes 90785 through 90899. Further, HBAI cannot be billed in conjunction with adaptive behavior services. And as you can see, if you bill for these services, several of these CPT codes have been updated for 2020 as well. I will note, however, that if a patient should require health behavior services and psychiatry services and or adaptive behavior services all on the same date of service, then the predominant service that is performed for that patient should be the service that is reported on the claim form.
In this next section, our presenters will share with you some resources for the 2020 Health Behavior Assessment and Intervention Code family.
Throughout this webinar series, we have reviewed all of the new CPT codes, the code descriptors, the RVU values, as well as the crosswalks for reporting the new HBAI services beginning on January 1, 2020. For your convenience, all of this information has been compiled into their own individual resources and are found on the reimbursement section of the APA website. That website is above the first link reported. We strongly encourage you to go and visit this site, download these resources, and begin familiarizing yourself as well as your staff with the new codes so that you're fully prepared to implement the new code set come January 1.
In addition to the current resources that we have available, we will be producing additional publications, new information and resources to assist you and your staff with making the transition and implementing the new HBAI codes that will go into effect in January. So specifically, one resource that is under development and will be coming your way in the near future, we are developing a health behavior assessment intervention billing and coding guide. This will be similar to the guide that was developed for the psychological testing and neuropsychological testing services. So we're in the midst of developing that, and we'll get that out and available. That will be available to not only members, but we'll also make that available to payers as well. Additionally, after the webinar and as questions start to come in, we will we'll have frequently asked questions and we'll respond to that, as well as additional resources will be forthcoming.
Thank you for viewing our webinar series on the new HBAI family of codes. And thank you to our presenters for sharing this important information to help us all prepare for 2020. APA Services, Inc. is available to help members with any health insurance or managed care issues, whether this involves private or government insurers. For issues related to billing codes and Medicare, or any questions regarding the content of this webinar series, please contact the Office of Healthcare Finance at ohcf@apa.org. For issues with Medicaid or private insurers, please contact the Office of Legal and Regulatory Affairs at praclegal@apa.org. If you are unsure of who to direct your questions to, you can also reach out to the Office of Healthcare Finance, and they will help direct you to the right person. Thank you, and have a great day.